For runners, it's exercise as usual during COVID-19, almost. Runners should check local mandates to determine if they're permitted to spend long periods outdoors. Running alone may be easier than maintaining social distance with more people crowding trails and parks. Runners should be careful about not spitting or touching the face to avoid transmitting SARS-CoV-2. To keep sweat off the face, athletes can wear headbands or hats. If runners choose routes with stoplights, they should either wear gloves or use an elbow to hit traffic buttons. And for now, runners should avoid intense workouts that can depress the immune system. In many places, cyclists can exercise as usual during COVID-19. Staying 6 feet apart should be possible, but often cyclists share food, water, or tools, so riding alone or only with household members is preferable. Cyclists should take everything they expect to need to avoid stopping at stores. Staying close to home can make dealing with unexpected incidents easier. Now is not the time for risky maneuvers that could put cyclists in the emergency room where they could be exposed to SARS-CoV-2. France, Italy, and Spain have imposed restrictions on recreational cycling outdoors, although it can be used for transportation to avoid the close quarters of buses and trains. The CDC states that the risk of COVID-19 spreading through pools or hot tubs is low with proper operation, maintenance, and disinfection. But municipalities and health clubs have closed pools due to the likelihood that swimmers will interact or touch infected surfaces on the way in or out of the pool. That leaves open water, which is warming now in many parts of the country. No one should swim alone in open water, so swimmers should either exercise with a household member or a friend who maintains social distance. Tennis lends itself to play during COVID-19 thanks to the ease of maintaining social distance with some precautions. Players can make plans online, play outdoors instead of indoors, and play singles as an added guarantee of distance. To avoid touching a ball after an opponent, each player can bring a new marked ball that only he or she touches. Players can also consider wearing gloves and using hand sanitizer. Players should either not change ends or avoid each other when they do. After a game, players should disinfect all surfaces they touch and leave the court separately without socializing. Although many golf courses have closed, a few remain open. With spring here, avid golfers will want to head to the links, but should book online. Now more than ever, they should walk instead of using a cart, and they should certainly not share a cart with anyone but another member of their household. Players should not touch surfaces that could hold SARS-CoV-2, from flag sticks to rakes to other players' golf balls. After a round, players should disinfect every piece of equipment used and thoroughly wash their hands. The 19th hole is also out. Your patients could consider group exercise, assuming the class includes no more than 10 people working out at least 6 feet apart throughout the session. Participants should bring their own equipment or be given new equipment to keep and bring to each session. Group exercise provides a chance for responsible social interaction, which may boost mental health during this time of social distancing. Outdoor sessions also offer the advantage of fresh air and sunlight, which is thought to have been a factor in improving survival from the H1N1 Spanish flu outbreak of 1918 to 1919. Although an after-workout coffee or lunch may be tempting, it's important to discourage any socializing as long as COVID-19 is a threat.